Good afternoon. It's Erie County Executive Mark Poloncarz coming from the Rath Building in downtown Buffalo with another COVID-19 update. And I'm joined by Jen from Deaf Access Services, who will be providing the American Sign Language for you today. It's just me. Dr. Burstein's always off on Wednesdays, so I hope you will indulge me for what I hope will be about a half hour. We have a lot of things to go through. But before we talk about COVID-19, I wanted to talk about the issues with regards to the protests and whether there was going to be a curfew in Erie County for tonight. I've had multiple discussions with representatives of New York State, local law enforcement, as well as municipal leaders from across Erie County, and we have come to a consensus that there is no need for a county-wide curfew tonight. There will be, of course, a curfew in the city of Buffalo from 8 p.m. to 5 a.m. After conversations with the town of Cheektowaga, it appears the town of Cheektowaga will be implementing a curfew tonight from 8 p.m. to 5 a.m. And it is my understanding the town of Orchard Park has also implemented a curfew every night through Monday, and I believe that is also an 8 p.m. to 5 a.m. curfew. We have no information indicating general unrest that could be planned, and based on yesterday being a very quiet night, except for when those storms came through, as I tweeted out, the god of thunder Thor was very, very unhappy yesterday. It was a quiet night otherwise. We don't have any indication that there will be issues. Though the city, of course, has a curfew through Sunday night from 8 p.m. to 5 a.m. So other than the city of Buffalo, the town of Cheektowaga, and the town of Orchard Park, there will be no curfew as implemented by me. Now, if things change, if we saw violence in our streets and those communities outside of those three, then we would consider implementing a curfew, but I do not have one planned. I have no interest in continuing curfews. A lot of people think this is something we want to do. It is not. It was done based on the fear, of course, what happened 2 nights ago with regards to the police officers being run down on Bailey Avenue and the incidences that had happened on Saturday night. But yesterday was a quiet night. I am hopeful that tonight will be a quiet night and that I never have to talk about implementing a curfew once again countywide. And I'll be glad to answer questions to the media afterwards. Once again, we were talking about COVID-19 as well, and as usual, we have an update with regards to what's happening in our community, some good news as well. And as usual, the proviso that we put on the screen that the information as presented can change and will change and often does change before we finalize the presentation, or I should say after, but before we present it. And for the latest information, always go to our COVID-19 page at erie.gov/COVID-19. Here you see the hospitalization numbers for all of Western New York, and they continue to trend downward. That's one of the reasons why we are in phase 2. In fact, as you see on the screen before you, we have some of the lowest numbers since the end of March, and that's a good thing. And we see the same thing with regards to Erie County. As of June 3rd this morning, there were 6,187 total positive cases out of 62,000 plus that were tested. 545 people have unfortunately died through yesterday evening. Each of those individuals had tested positive before they passed while they were alive, and there are no presumed positives. And as always, I offer my deepest condolences to the friends and family of those who've passed. Unfortunately, I know people who've lost loved ones, and they have not been able to normally mourn as they would with regards to there being no funerals or there being lack of wakes. So I just want to offer my deepest condolences on behalf of the people of Erie County to those who've lost loved ones as a result of the COVID-19 outbreak. On June 1st, there were 123 individuals admitted to Erie County hospitals. I think that actually should be 122. It might have hit the wrong button. We'll see that on the next page, and we'll look at it right here. Yep, it's 122. And as you'll see, that number has continually gone down. It wasn't that long ago. It was much higher. It was 186 on 2 weeks ago, and that number has continued to go down. That's a good sign. The ICU and ICU assists have been pretty static lately. They've stayed fairly constant, but they are at some of the lowest numbers we've seen in more than 2 months. And we did have 1 death on June 1st. We had 6 deaths in area hospitals on May 31st. As you can see, these numbers with regards to deaths are deaths in hospitals. It does not include all deaths in Erie County, whether they occurred in a nursing home or some other facility or just at someone's house. But those numbers continue, at least on the death numbers, except for that 1-day blip on May 31st. They've been fairly constant and lower. And that's important because that's one of the important metrics that ensures whether we move into the next phase. This is the hospitalization data dating back to March 27th, and you can see that we now have the lowest hospitalization since March 29th and the lowest ICU and ICU assist since we actually started getting this data from New York State. So that's a very good sign, and you can see the trend line is continuing to go down, and I'm very happy to see that. Hospitalization data, these are the individuals that are admitted versus discharged, and we continue to see that in the last few days, discharges are exceeding hospitalizations. We talked about it on Monday, the blip that occurred between the 24th and the 27th of May. It appears that on those dates that individuals who were going to the hospital that were COVID-19 positive were seeking and received treatment in the emergency departments, but were not admitted, were also being included in the number that we received from New York State. So that threw off those numbers with regards to hospitalizations. We know that people are going to the emergency department more than are being admitted, but they are being treated and then provided whatever resources they need to go home and deal with their COVID-19 illness at home. Not everybody needs to be hospitalized that has COVID-19, and you prefer that they actually get through their hospitalization at home. So we do know that there was a blip on the 24th or the 27th in which it made the hospitalizations admissions look much higher than what we were seeing with regards to total hospitalizations. And we believe it is because individuals were included in the admissions data, even though they were truly not admitted, but were being provided services at the hospital through the emergency department. Cases, we've seen this chart for a while, which shows the cases based on age grouping, but I wanted to include today the breakdown by numbers so you could actually see it more clearly. Sometimes the bar charts aren't as clear with regards to percentages and what it really means. But as you can see on the screen, it runs the gamut. And those between the ages of 70 and 79 have less cases than pretty much every other age group other than those that are teenagers and younger. So just because you are young does not mean you won't get it. When I say young, I'm talking about those in your 20s and 30s. So it's important for everyone to understand that you can contract the coronavirus and you may not get very sick or sick at all, but you could pass it on to someone where it could be a death sentence. So we want to ensure that people understand that every age group has cases with regards to the coronavirus. And the younger you are, the less chance you have of being hospitalized or die, but you certainly have a chance of passing it on to someone else who could be hospitalized or die. And then the numbers with regards to males and females. Females make up roughly 57% of those who've tested positive for COVID-19. And the numbers with regards to the city versus the suburbs, we've had some folks saying it's predominantly striking people in the city of Buffalo. That is not correct. Though the population of COVID-19 cases for those who live in the city of Buffalo versus those that live outside of it is higher than the city's actual population. So this is not an illness that just affects people in the city of Buffalo. It affects you everywhere, though we have seen higher rates in the city of Buffalo based on what the population is compared to what we've seen in the suburbs. We'll talk a little bit more about that again in the mortality data that is coming up very soon. Diagnostic tests, we continue to test thousands and thousands of individuals, and I think it's important for people to realize that it is something that we need to keep track of, which is the diagnostic tests and determine how people are testing positive. And as you can see, the trend line continues to go down with regards to the number of positive tests versus the overall tests. It's now down to a 6.1% that tested positive. And previously it was over 30% in some weeks. So we're testing a lot in the last week, I should say. And when we look at the total number of tests that were performed, we were testing many more people, but less people are testing positive. But that still indicates to us the coronavirus is in our community and is being spread among members of the community. That's why we still need to follow safe social distancing guidelines, wear our masks when we're out in public, when it's not feasible to be socially distant, and do the right thing to protect our fellow citizens. We see the same thing, that the numbers are going slightly down with regards to those who are testing positive for the antibody. And as you can see, we had a big drop in the number of people who tested positive by antibodies in the last week. The week before, over 14,000 people had been tested, and 1,000 had tested positive. And then we had 6,300 tests in this most recent week, then ended May 30th, and only 445 tested positive, about 7%, with an overall testing positive rate for antibodies at 7.5%. So that confirms once again that even though we have less tests last week, people are still testing for COVID-19. And if you roughly say that 7.5% of the population has antibodies, that means 92.5% of the population have not contracted it, and they're still at risk for contracting the coronavirus. So once again, wear your mask when you're in public. It certainly is going to protect you a lot more than if you don't have one. It also will help protect other people if you should have it and don't know it. And please practice safe social distancing guidelines. Mortality data, you've seen this chart over and over, and we continue to show that when it pertains to age groups, in almost every age group, males outpace females with regards to deaths, except in the 80-plus age group, in which, in general, there are more females than males. So it's generally, if you're a male, you have a much more susceptibility to being hospitalized and dying from COVID-19 than if you are a female, except in the 80-plus age group, which is not surprising because there are many more females in our population than males, just due to females generally outliving males. The percentage of the population for mortality based on mortality is based on residents. And as you can see, it's pretty close to the actual population numbers for the city of Buffalo versus not city of Buffalo. And there's actually number of people who died in the city of Buffalo is less than the actual percentage of the population of Erie County. And the same thing, that means that there's more people who've died that live outside the city of Buffalo than their percentage in Erie County. So that shows that we're not necessarily seeing a greater than amount of people dying from the city of Buffalo, even though we have a high level of contraction there. And then when you break it down by race, you've seen this repeatedly for some time now, and the numbers continue to go down for African Americans. At one time, it was nearly 33% of all deaths related to COVID-19 were people of color, African Americans. That has dropped, and it's almost to the point where it matches up now with the percentage of African Americans in our population. So we want to continue to see that number go down, not go up. Other parts of the country have seen tremendous increases with regards to or discrepancies, much higher proportion of those who've passed being African American than the percentage in their population. We don't necessarily see that here, and that's just a testament to the great work that's been done by so many across our community in our healthcare field, in the African American Health Disparities Task Force, and so many others. Erie County responds, a lot of the same stuff you've seen before. The diagnostic testing, 858-2929, to get tested to see if you have COVID-19. You do not need a referral from a doctor. You just need to feel you are at risk to exposure. It's by appointment only. It is not, you can just walk in and do it. There are available clinics across Erie County. When you call, they'll tell you the clinics that are available, and you can choose one. If you're ill, you should get tested right away. If you're not ill, but you have risk or fear that you may have, you could potentially wait for a clinic closer to you. But once again, it is by appointment only, and we need you to show up to your appointment. Otherwise, you're taking an appointment away from someone else. Antibody testing, you can call 858-2929 to set up antibody testing. There is no walk-ins, and as you saw, we had a big drop in numbers the week that ended May 30th versus the week that ended May 23rd. So less people got tested for antibody testing in the prior week, but you have to call for the free antibody testing. There are others that are doing antibody testing across Erie County. Some of them are charging for that cost. We do not. It is free. And the places rotate across the county: Buffalo, Orchard Park, Springville, Williamsville. And once again, if you schedule an appointment, please show up. Please show up. There are multiple testing sites across Erie County, and you can, this is not just Erie County sites, but sites including pharmacies and what hospitals and others are doing, doctors' practices. So there are lots of sites, and you can find one closest to you by going to our COVID-19 site map, which is available at erie.gov/COVID sites. So if you're looking for a testing site, there's lots of them in our community. We're in phase 1 and phase 2 now. Hooray! I called my stylist to try to get scheduled, and I need to get a haircut. I'm going to get a trim. I'm not going to take it back as short as it was. I like it a little longer. Had a lot of positive comments about it. And yes, I've had a lot of people wonder, do I dye my hair and is it real? I think we've proved lately the hair is real, and I do not dye. I'm lucky I have good genes, but hopefully soon I'll have a little shorter hair, but I will be keeping it a little longer. But all of these phases you see on your screen are open, and the governor announced that when it pertains to food, there will be available to do, I believe all restaurants will be able to do outdoor food service, I believe effective tomorrow. It was just announced by the governor's office. Indoor food service is phase 3, so that is still not here, but we're in phase 2, so they'll be able to do outdoor food service, and I know a lot of us would love to be able to sit outside on a nice day and have a good dinner or lunch, and we'll be able to do that very soon. But all of these are open, including barbers and salons, and we want to remind all barbers, beauticians, stylists that you can qualify for a free face shield from Erie County. PPE is required. You must wear a mask at all times when you are in your salon, your shop, but you do not need to wear a mask until you're cutting hair. And if you start cutting hair, you have to have you have to wear a mask all times. You're not required to have a face shield until you cut hair. But Erie County is offering free face shields and other PPE for barbers and stylists that are licensed with New York State. You have to register on the New York State site to get your license. But we don't worry about that in Erie County, but we do worry about providing free face shields, and that's what we're doing. So you have to register online at erie.gov/face shields. That site is online, and we had our first distribution of face shields today at the location, and I've heard hundreds were picked up already by barbers, stylists, as well as owner-operators of barbershops and beauty salons. I'm very glad to hear that. It's a service that we're providing to our citizens, and it is free. And that opens up to questions and answers. Once again, I just want to affirm we've had some very stressful days over the last week. We've truthfully had very stressful days for the last few months, but they've been added on with regards to the protests and truthfully looting and rioting that has gone on, not just in our community, but across the nation. We all stand united against injustice. Yesterday, I showed up at one of the protests in downtown Buffalo, which was a peaceful protest, to show my support for those who are peacefully protesting and to also let them know I stand with them to eliminate and root out police brutality and stand up to injustice no matter wherever it is. And I was glad it was a peaceful protest. Yesterday, there were no real incidences. I know Buffalo police did clear out Niagara Square after 8 o'clock. There were no arrests. I'm not aware of any arrests that were made across the county with regards to any protests, and that is one of the reasons why we had no evidence of looting or rioting, and that is one of the reasons why there will not be a countywide curfew tonight. However, the city of Buffalo has a curfew from 8 p.m. to 5 a.m. The town of Cheektowaga is implementing a curfew from 8 p.m. to 5 a.m., and I believe the town of Orchard Park also has a curfew from 8 p.m. to 5 a.m. With that, I'm going to open up the phone lines and take questions from local media, and we will start at the bottom because I started at the top last time. And so first question goes to Ethan Powers from B News.
Hey, Mark, hope all is well. A couple of weeks ago, I asked about the earliest potential for us to enter into phase 3, and you politely declined to answer before we were given the go-ahead for phase 2. Now that we're officially in phase 2, I'd like to try again somewhat here. We know that the initial phasing parameters set by the governor's office included a 2-week period between phases, and obviously you can't speak to hypothetical rises in hospitalization rates. But if the pattern of declining cases continues here, is it your estimation right now, given the data, that we could see Western New York completely reopen by July 1st?
Well, not completely reopen. I'm not exactly certain. I'd like to say that phase 3, if we continue on this trend, would move towards 2 weeks from when we moved into phase 2, which was yesterday. Phase 4 would be technically July 1st if we continue down that trend. I'm not certain if everything will be allowed to open at 100% capacity in phase 4. So I don't want to say completely open by July 1st. I still think there's going to be a lot of mass events that are canceled and are recommended not to be held, like the Taste of Buffalo, things like that. So if we continue on the trend, we'd be talking about 2 weeks from yesterday for phase 3, and then 2 weeks from that point for phase 4, but I'm not certain about complete opening, and I don't want to say that and make everyone think that we're going to be back to normal effective July 1. Anybody from WBEN? Mike Baggerman, Brendan Keeney? WBEN, are you?
Hey, Mark, it's Tim Winger.
Hi, Tim.
How you doing? Can you just characterize a little bit more the decision concerning the curfew? It seems the curfew certainly may be a factor that helped last night. Do you at all feel or fear that a decision to not have a curfew is, being made too quickly?
Well, it is a concern, but I think after conversing with local officials and law enforcement officials, we don't put a curfew in just because we're fearful that something would happen if we don't have any information to indicate it's a possibility. We also realize when you put a curfew in, you're hurting businesses. A pizzeria that normally would sell pizzas till like 10 or 11 at night really can't do it. So we're a little worried about that aspect. If I had any idea that there would be a significant issue in the county outside of the areas like that we talked about, especially the city of Buffalo, I would not hesitate, but we don't have any information, and we didn't have anything yesterday. We were conversing with our local law enforcement, and they were saying, not only from the county but elsewhere, that the curfew was in place, but they had no indication to say that there were problems. We do have a curfew in the city of Buffalo, and that is always going to be the hot spot, we think. So the curfew is in place. And if there are individuals that are going to think about, I won't do it in the city, I'll go elsewhere, I do want to remind everybody there's going to be a lot of police presence on the road still. And I do not recommend after 8:30 that people go outside and travel unnecessarily if they can avoid it. There's really no reason to do it. There is going to be a big police presence. It's as simple as that. So if people are thinking, I can leave at 7 o'clock and I can go somewhere else, you're going to see a lot of police on the suburban and rural areas anyway. So I think it's fair to say we don't want to keep people who are not going to violate laws stuck in their homes. But we also want people to understand if you're involved in thinking about criminal mischief, you're going to run into a lot of police tonight anyway. WBFO, Michael Mroziak.
Heard from the Lieutenant Governor this afternoon that elective surgeries and ambulatory care can resume. Are there any other important non-COVID medical updates for Erie County hospitals that you can share?
I just got that recently. Actually, I was texting with the governor this morning. If you can go back to mute, Michael.
Sorry.
And all of you, if you're not speaking, could you go to mute? Just causes problems. I actually was texting with the governor today to try to find an update, and the governor said he would get back with us later, and the announcement was that they've re-allowed electives at Buffalo General and the ambulatory care places, so I want to thank the governor for implementing it. It just goes to show that you have to sometimes be persistent, and I'd show you the text, but I don't want to reveal the governor's phone number because it's on the text, and I don't think he'd be very happy at that point. But yeah, we've been pushing for it for some time, and I'm glad it happened. It was about time that it happened. We've seen our hospitalization numbers go down. In COVID cases, we've seen other hospitals do elective surgeries. Our ICU numbers are still very good, more than 50% capacity, and there was no reason to prevent somebody from getting a colonoscopy in a non-hospital setting, because they may need it, especially if they haven't had a chance to have one for the last 3 months. So I'm very glad that that has been allowed by New York State Department of Health, and I thank the governor for help pushing that along. Buffalo News, Sandy, are you there? I'm sure she's unmuting her phone.
Yes. Yes, thank you. Can you talk a bit about just what trends are as far as closing what the deficit that exists now, given that there is still no certainty regarding federal funding?
Yes, we will be releasing our plan tomorrow. I saw a version of the plan and I signed off on it yesterday. However, we got our final sale, I shouldn't say final. We received our first sales tax numbers for the month of May as of 1 p.m. today. I have not seen what impact that has on the plan. We had estimates based on the April numbers. We had nothing on the May numbers. So we had a number of potential plans that we would implement to address what was going to be a significant deficit, more than $100 million, but less than 220, actually less than 200 million, what we originally had talked about. So once I leave this phone call, or this presentation, I should say, I am going to talk with our budget staff about what the plan will look like. And that plan will go over to the legislature tomorrow, based on the timeline we had chosen. So I don't know what the final plan looks like. Right now, the plan includes cuts. It includes using of fund balance. It includes major reductions across the board in budget lines that we control. So there's going to be a lot that goes on in the package, and it's also going to be dependent on what we send over to the legislature with the excuse me, the budget numbers when it comes to sales tax for the month of May from our largest providers, so to speak, the ones that generally pay the vast majority of the sales tax. And that was received at the budget office at 1 o'clock. They're making modifications to the plan right now, and once I've had an opportunity to sit down with them and review it tonight, we'll send over the final budget package tomorrow.
So can you say at this point whether there'll be layoffs or furloughs?
I won't say anything till we reveal tomorrow.
Okay.
Spectrum News, I believe Aaron is there.
Yes, just a question about the people who have been heading out to these rallies and protests. Should they be getting a COVID test since they've been in these large crowds?
They should consider it. I'm glad to see the vast majority of people who've been at the peaceful protests are wearing masks. So that's a good sign, but that doesn't mean that the mask is 100% foolproof. Based on the size, and we've talked about how our testing is coming back for every test that we're doing, we're basically, the PCR test, the diagnostic tests are coming up 6% or so of the tests recently are coming up positive. So if you have 1,000 people in a crowd, if you tested them, the odds are 60 may actually have COVID at that time. So if I was at these protests and I felt that it wasn't a good thing, if I was, like yesterday, I stopped off at the one protest, I was wearing masks, I wouldn't shake hands with people, I was giving them the elbow bump, or the Spock, live long and prosper. I think that might be the way to do it from now on, rather than handshakes. You might want to consider getting a test. If you've been at every one of these protests, you might want to consider getting a test. And the test is available and it's free through the Erie County Department of Health at 858-2929. Leanne Stuck from Channel 2.
Hi, Mark. Thanks for taking our questions. My question is in regards to the state's announcement today about restaurants now being able to have outdoor dining. I know that there are going to be a lot of restaurants throughout the county that want to get in on the ability to have business through outdoor seating who may not already have outdoor seating. Is the county able to work with these businesses to try and waive any permits necessary so that they can add outdoor dining to their businesses during this time specifically?
Well, the vast majority of that is actually handled by the towns or the cities with regards to permits for outdoor seating. The county would provide a health permit. It generally does not provide permits for outdoor activity. That is usually the town or city that does it. If there are issues that need to be approved through the Department of Health, we'll be looking at that. I know some restaurants wanted this. Others were saying that if they couldn't do indoor seating, it really wouldn't matter to them. They wouldn't probably do enough business to justify bringing their staff in if they only had 4 or 5 tables available. So it's going to depend on the restaurant, but they need to confirm with their town or city and most will require a patio permit. And if you do not have a patio permit right now, you need to talk to your town or city on that. Erie County cannot waive any rule that is a lower level government's requirement. Kelsey Anderson from Channel 4.
Hi, Mark. I was just wondering if there was an update on the reopening of county beaches.
Yes, we're hoping to reopen them fairly soon. We do need to have sufficient staff. The beaches will not be open for swimming until we have lifeguards, and that would not happen at least till phase 4 is implemented. The beaches there's only really one county beach that is a swimmable or a nice beach. That's Bennett Beach. Went Beach is an issue the last few years with regards to the way the water is blowing rocks on and you can go there, but it's not really the same as Bennett Beach, which is a gorgeous sand beach. Right now, that is still closed until the Parks Department has enough staff to ensure that we can have safety associated with it. And we are looking like that may happen in the next week, but it's not there yet. Parks Department has been working to open more facilities as time goes by. A lot of people have asked about bathrooms and the shelters that we have. We're still not supposed to have those open under the state's rules with regards to recreational activities. We have shelters. We have bathrooms open in the parks in the larger buildings, like the casino buildings and the like, but the freestanding shelters are sometimes in the middle of parks. Our bathroom facilities are still closed. You got to check with your park to see what's open and what's not. We have to ensure the safety of all, and that's why until such time as we can get the go-ahead from New York State and we feel it's safe, we will reopen those bathrooms. But the beaches, the beach, at least Bennett Beach, I'm hopeful will be open at 50% capacity, not full capacity, within a week. Channel 7, Ashley Rowe, Allie Toohey.
Hey, Mark, Allie here. I just wanted some clarification, if you could. Orchard Park CIO Patrick Fitzgerald said that their curfew had been canceled as of this afternoon. Did you hear something new within the last several hours that they reinstated it, or could that be perhaps just miscommunication?
I just got something I'm reading right now that since we've started, this is why we have the provisos, Orchard Park has rescinded its curfew. I do know that the Supervisor Pat Keem had issued a curfew individually, and we had been told it was through Monday, but you see, well, that's why we have provisos. They sometimes change, and it has been rescinded, I guess, in the last hour. And as a result, the only places that will have a curfew tonight are the city of Buffalo and the town of Cheektowaga. We will look through the night and see if we have to revisit that, if there are indications of issues elsewhere. And for those who are thinking about doing mischief, I'm going to tell you, there's going to be a lot of police on the roads tonight. A lot of town police, a lot of city police, a lot of village police, the New York State troopers. There are hundreds of them that have been brought in Erie County, and of course our Erie County Sheriff's Office and the deputies associated with them. So if people want to engage in mischief in our community, you are really going to put yourself and others at risk. Don't do it, of course, because it's breaking the law. But there's going to be a lot of police on the streets tonight. So while the curfews will not be in place except for Buffalo and Cheektowaga, if you think you can take advantage of the situation, go ahead and do it, and you're going to find yourself like those individuals who were breaking into the Targets and got arrested in Orchard Park. They're now facing significant charges, and you don't want to ruin your life just because you think you can break a window and maybe get a flat screen TV. It's not worth it.
Mark, oh, sorry, Mark.
Go ahead, Ashley.
I just want to jump over to back to the outdoor dining. Of course, the weather is about to take a nice turn. It's going to be sunny, high 70s, right through to the weekend. Just want to clarify, because the city has a curfew, the city of Buffalo, you cannot be out to even eat or drink at a restaurant outside in Buffalo after 8 p.m. tomorrow or any night through Sunday.
Tonight,
right?
Yes, tonight through Sunday. So they could do outdoor dining during the lunch hours or I guess through 8 o'clock, but really we don't want people out afterwards even. So you would really, if you're a restaurateur, you'd have to seriously think whether it makes sense to do it for the evening hours, because you probably have to shut down by 7 so people could get off the streets by 8, including your staff. Those are the rules. There's no exception. Just because they're having outside dining now does not give it an exception to violate the curfew. And if a restaurateur did that, they would be in violation of the curfew and then could be shut down, and I don't think any restaurateur is interested in doing that. Anyone else I did not call who may be on maybe on? If not, we'll go back to the bottom and just ask one more question of everybody if they would like. B News, Ethan Powers, do you have any more questions?
I'm all set for today, Mark. Thanks.
Okay. WBEN, any more questions, Tim?
Hey, Mark, just quickly on COVID, are you aware of any compliance issues with regard to businesses that were granted, rights to reopen and conduct business beginning yesterday under phase 2?
I am not aware of any. That is not to say it did not come in, but I do not have any evidence of that. I'd have to check with our hotline, 858-2929. They get the calls usually if there's non-compliance issues, but I have not heard of any so far. I think most are following the rules. As I said, the place I normally go in North Buffalo for a haircut, they're not even opening until June 8th. And I think a lot of the places that have an opportunity to open, some opened yesterday, others opened today, but not all of them are open. They want to make sure they're following the compliance guidelines. And then you also have to fill out that affirmation with New York State saying you have a safety plan. And if you don't, I'm sure we're going to get the calls, and then we're going to have to send people out there, and it's not something I'm interested in doing, but we will do it if need be. WBFO, Michael Mroziak, any more questions?
Everything I need was covered. Thank you.
Okay. Sandra Tan, Buffalo News, any more questions?
No, Mark, I think it's...
Okay. Aaron from Spectrum News.
All set, Mark. Thank you.
Okay. Leanne Stuck, Channel 2.
I'm all set too. Thank you.
Okay. Kelsey Anderson, Channel 4.
Same. I'm all set. Thanks.
All right. And we'll finish then with Ashley Rowe and Allie Toohey, Channel 7. Any more questions?
Mark, I do have one more question. Ashley here. I know you're offering face shields to all hair salons and barber shops, but some businesses in the 14215 zip code wish the county would do more to provide additional PPE and specifically cleaning supplies to businesses in that hardest hit area, that 14215 zip code. What do you say to them?
Well, those that are legitimate businesses can apply for PPE through our Department of Homeland Security and Emergency Services. We do not provide PPE to everyone, and what we have done is provided lists to businesses of the vendors that are out there. We have a specialized vendor list in which you can actually sign. We've identified the vendors. So if you go to our Erie County COVID website at erie.gov/COVID19 and click on the link for businesses, you will find a page there which identifies the vendors which are selling PPE. We do not provide PPE to every business. We would not be able to do it, and we would truthfully run out of PPE when we have to provide it for healthcare organizations, nursing homes, and hospitals, as well as our own folks. So we do not provide PPE to everyone, but we do provide links to PPE, and we are willing to assist in some PPE, but we do not provide it for everyone, and it is a business's responsibility under the law to provide PPE for their employees and to ensure that their site is properly cared for. I cannot just say we're going to provide PPE to businesses in one zip code and exclude every other zip code. I have to include every other zip code and every other location in Erie County, and we truthfully do not have enough PPE to do that and then meet our standards that we have to meet, which is provide them for not only my own staff here in Erie County and the other staff in county departments, but hospitals and nursing homes. With that, we will wrap up for today on Wednesday, June 3rd. I thank everyone for your work. We are going to very soon return back to traditional press conferences here. It may not be this week. It'll probably be next week. But when we do that, we are going to have limitations on the number of representatives from each agency. They will have no more than one person that will be allowed and one cameraman for television. We have a larger room for press now. But it is not set up for every person that the press would like to bring in. So if it's not on Friday, it will probably be next week where we actually reopen our press facility so we can have in-camera interviews. But unfortunately, we're trying to also ensure that we're protecting everyone, so we cannot have every cameraman and every press person that each media outlet would like to send. We did that at the beginning of COVID-19, and it was truthfully ridiculous, in which we had 40 to 50 people in a very small room, and that's just not a safe way of doing it. In the meantime, I wish everyone be safe, be well. Please, if you're going to protest, protest peacefully. Do not engage in activity that, while you may feel is appropriate to voice your opinion through your voice, through what you want to say by writing to us, but don't do it through throwing of bricks and bottles and rocks and looting and rioting. That does not create a more just society for all. It actually divides us. And the best way to address injustices is to bring each of us together, regardless of the color of our skin, regardless of our ages, regardless of whether we live, where we live, urban, suburban, and rural areas, together to address the injustices that we know all exist. We need to be united in our efforts. We need to understand that hate can only be driven out by love, as Dr. King said. But as we all know, we are a better society when we care about each other and we love each other. So please, be safe out there, be well, and until then, I hope everyone has a peaceful night.